afternoon to all of you. This is Dr. Shivramakrishna, coordinator of this program on Atal AICT sponsored 1 week online FDP on 3D printing and design. We are into the 9th session. We are in third day, last session. Today, I hope from the morning onwards, you had an exciting journey. Morning, we had design for manufacturing by IIT Professor Surya Kumar Garu. And he was very precise in telling what is the importance in 3D printing. Designing is the most important aspect. Then we had a very exciting journey on how 3D printing can be used on orthopedic applications. And Professor M.V. Redigar from Sunshine Hospitals have taken us through a journey how 3D printing is very useful in additive manufacturing, and he has shown us the limitations and also what is the hype in 3D printing that is happening to us. Now we have to in the afternoon session a very interesting speaker. I would like to say, I would like to thank here that Professor Abhinandan Garu from that is SV Medical Dental College from Nagar is closely associated with our college. I think from the past 8 years he was with us, and we are combinedly doing a lot of work in maxillofacial and dental surgeries. In fact, we both has proposed a project at UGC which got funded, and SAR provided us a lot of inputs how to carry that research. And he is a very young professor, doctor with again academic interest. So I told in the morning, only we find few doctors with lot of academic interest. Sorry, pardon me, sir, don't think otherwise. But I think few young doctors also, few young doctors. I got fortunate, I am fortunate enough to got association with him. And I thank you, sir, for sparing your valuable time. I know how busy you are. So you are always busy with so many other activities. And my PhD scholar will going to introduce what are the about speaker, what are his qualification, everything. He is very well versed in application of 3D printing in dental and maxillofacial surgeries. So I welcome you, sir, to this session on
Thank you, sir.
application of 3D printing for dental and on maxillofacial surgeries. Sir is going to present you some of the live case studies, and it is very interesting. After lunch, I hope he will not make you to sleep. That is, I think, most important thing is the live case studies that he is going to present will make you to sit and listen. As in the afternoon, you are asking so many interactive questions. I hope you will also start continuing the same thing. Be attentive and listen to his lecture very clearly. Sir, I will just share you the screens.
Yes.
Once my PhD scholar introduce you, then I'll give the share screen option. Right?
Sure.
So please, Sweta, please carry on with your introduction part, please.
Yes, sir. Thank you, sir.
In the record mode only, no? Please continue.
Thank you, sir. Is the recording on, sir? Can I continue, sir?
Yes. On.
Okay.
On. 1 minute. Again, I will recheck. Sometimes it's on only, but still I will see. It's on only.
Shall I continue, sir?
1 minute.
Yeah.
Please go.
Good afternoon, everyone. I welcome back all the participants to the post-lunch session of Atal AICT Online FDP. I'm glad to introduce Dr. P. Abhinandan, sir, speaker of session 8, and sir will talk on applications of 3D printing in dental and maxillofacial surgeries. Dr. P. Abhinandan is currently working as a professor in the Department of Oral and Maxillofacial Surgery, SVS Institute of Dental Sciences, Mehboob Nagar, India, and as a consultant maxillofacial surgeon at Premier Hospitals, Continental Hospitals, Fort Hospitals, Hyderabad, India. Sir completed his BS from Rajarajeshwari Dental College, Bangalore, and MDS in Oral and Maxillofacial Surgery from Government Dental College, Trivandrum. Sir has many additional qualifications which include AOCMF Fellowship in Microvascular Reconstructive Surgery of Head and Neck from Peking University School of Stomatology, Beijing, and Fellowship in Cleft and Craniofacial Deformities from Amrita Institute of Medical Sciences, Kochi. His areas of interest and expertise include microvascular reconstructive surgery of facial defects, orthodontic surgery, facial trauma. Sir has many publications, scientific presentations, and courses. And sir, to take over the presentation.
Thank you so much for that kind introduction. Yes, sir. Yes, sir.
Again,
Yeah, is my screen visible, sir, now?
yes, yeah. You can continue. You can continue.
Yeah. Yeah. Okay, sir. Thank you, everyone. Thank you, sir, for that kind introduction. And before I start, I must thank Sivaram Krishna, sir, for this opportunity. And it's my privilege to be associated with his department from many, many years. We have done lot of work together. We had publications together, and I'm grateful to him to be part of this great work we have been doing together. Thank you,
Sir,
sir.
you are
Thank you for this
also
opportunity.
invited by our director, Professor Sriram Venkatesh, sir, who is also coordinator of this program.
Yes, sir. Yes, sir.
Our centers. Thanks.
Yes, sir. Thank you, sir. Thank you for that opportunity, sir. So I'll just begin with this talk. Good afternoon to everyone. I know it is an Herculean task to keep you all awake post lunch session, and I'm sure you all have been exhausted from great lectures since morning. And but it also makes my job easier to a certain extent because you have been introduced to this topic in multiple ways by many great speakers who spoke before me. So that makes my job relatively easier. So what I'm going to do, as sir was saying, is that I will be talking in terms of case presentations, which I will be sharing with you all in upcoming slides, so that you will understand exactly how this 3D printing technology is applicable in facial reconstructive surgery, in maxillofacial surgery, and in dental surgery. I'm sure you all would have heard this word dental surgery before. It's nothing but dentistry. But apart from dentistry, the horizon of dental surgery goes beyond mere dentition and oral cavity. It is more about a reconstruction of the facial region, cosmetic surgeries of facial region, treatment of the oral cancer, treatment of various facial traumas like facial bone fractures, facial soft tissue injuries. All these things come under our domain. And this is where actually 3D application comes into picture. The customization process has begun many years ago, and when it started off, it was extremely expensive to. It was only in a research phase where it was only experimented and it was only possible in the labs. But now, with the increase in the demand for this particular customization and for 3D printing process, because there is an increase in demand, especially in the medical fraternity, the cost has significantly come down, and there are variety of plethora of materials which are available which can be used for printing, starting from the polymeric material to metal like titanium. So because of this variety of material which is available, the cost factor and the demand rose, the cost factor came down significantly, and it has become common use. 10 years back, if I would have thought, if I wanted to use this 3D technology, it was almost I have to find a patient who is really affordable, who is elite patient, who can really afford this kind of technology. But now it is like available to each and every one of us. It is very routinely available. So this brings to me to my topic, which is nothing but application of 3D printing in dental and maxillofacial surgery. As I have been introduced, I am Dr. Abhinand Poturi, and this is my area of interest in the 3D printing is one of my primary area of interest in facial surgery. So I will take you through a few slides, which will be quite interesting. If you see, I'm sure you will understand it very easily because I'll try to keep it as simple as possible in layman terminology, so that I'll be able to connect to you all. See, if you see, look at a face. Face is not a straight bone. It has got multiple bones. It has got many vital structures like the nose, like eyes. You have a major organ, the brain, right above. Then you have your oral cavity through which you take food, you ingest food. And there are so many other vital structures like your ears and all those things. And it is a dimension. It has got multi dimensions. It is not just a single uniform. If you take a hand, it is a straight bone. If you look at the hand, but In the face, it has got multiple dimensions and multiple kinds of bones, which has got different shapes. Now here the challenge lies. When there is some loss of certain structure of the face, certain part of the face, certain part of the facial bones, like in case of accidents, or like in case of some tumors, or like in case of some cancers, where we do surgery and then we remove that part of the bone or that part of the facial structures, then it will leave the patient with huge facial deformity. If there is some deformity on the hand, it can be hidden under your clothes. But on the face, it is striking, and you will carry that impression throughout your life. And it will affect your self-esteem, it will affect your confidence, and also it will affect your day-to-day functioning. And more than that, it will affect your aesthetics. And it will become a social stigma in certain parts of the country. So this gives us the idea of how important it is to reconstruct the face. And more than that, because of its three-dimensionality and because of its complexity compared to other parts of the body bones, the complexity of the facial bone, here the 3D printing comes into picture. Before the days of before the advent of 3D printing, that is probably 8 or 10 years back, which was when it was not very common in medical profession, constructing these facial bones was considered almost impossible, or it was never perfect reconstruction. It was reconstructed in whatever possible way, and people are asked to live with whatever possible deformity. It was considered as this is the maximum anything can be done. But the 3D printing has just revolutionized the entire reconstructive process in the facial bones, and it has brought a paradigm shift. And because of this, we can comfortably patient a very good quality of life. And I'll explain to you this with this simple case. If you see on your screens, this is a young patient from a rural background, and if you look at his face, just let me use this as a pointer. Yeah, if you look at his face, you see there is a huge swelling on his lower part of the face. If you see on this direction in this picture, you see this, his chin is projected forwards, giving him appearance of some kind of a primitive appearance, because what happened actually is this particular patient, when you see inside the mouth, there is a huge swelling, which indicates that there is a big tumor on his lower jaw. The lower jaw is called, this is the lower jaw, which is called the mandible. And this lower jaw is prone for many kinds of tumors, many kinds of cancers, especially in our country, where the tobacco chewing, gutka, pan, zerda chewing is very rampant. The oral cancer is one of the greatest killers in Indian subcontinent. And this is not actually cancer, what you're saying, but this is a tumor which is very similar to that of the cancer. And what does it do? If you leave it like that, day by day, it eats your bone and makes your bone weak. And one day the bone will completely be disappearing, and he will be left with a big tumor on his face. So this is when the patient has approached to us. And the only option left in this kind of situation is to resect the tumor. Resect the tumor means resect that part of the bone which is carrying tumor. But imagine if we remove this part of the bone completely. See here, if you see, this is a CT scan image of this patient, which is three-dimensionally reconstructed. You see how this bone is completely eaten away. This is a normal bone, whereas this bone is completely eaten away because of the presence of the tumor. And see the direction of the teeth, they have all become haywire, and they're literally hanging in the air. So the only option left in this kind of situation is to remove this amount of the bone. That means this amount of the bone will be taken off and it will be gone from the patient's body. Now imagine, this is a prime part of the face, and your lower jaw gives a significant contribution to your speech, to your mastication. That means the ability to chew food, eat, and then to your cosmetics. The entire facial contour is defined by your lower jaw. Now this important part of this lower jaw is gone missing, and you don't have that jaw, then how much of function, how much of cosmetics for the patient is impaired because of this. This is the problem. And now if we have to replace this bone with some other part of the bone, there's no other bone in the body which has got this kind of shape. Is there any other bone? If you take bone from the hand, if you take bone from the leg, any bone for that matter, no bone has got this kind of horseshoe shape. All bones are straight bones. Now, if you have to take any other bone from the body and reconstruct, which is the only modality to treat this kind of deformities, then what is the option? The option left is to take a straight bone. Usually what we do is we take the bone. This is a surgical procedure. What was done? We have resected the tumor. As you can see, the tumor has been reached. And then if some of you might find these pictures a little gruesome, but have purposely put these pictures on the slides so that you will understand the intensity of the need for 3D reconstruction in applications in facial reconstructive surgery and maxillofacial surgery and in dentistry. That's the reason I have put. Okay, so I'm sorry if any one of you find these pictures a little gruesome and little what you call as drastic. But this is what we do in a day and night in the operation theater. This is what we do. This is what we see. So I want you all people to know these kind of things happen and these kind of things are done. Only then you will understand and you will be able to connect to the real need of 3D reconstruction and 3D printing in maxillofacial surgery application. So you see this jaw is being removed along with its teeth. The entire, this is the tongue of the patient, this is the upper jaw, upper teeth, and the entire jaw is resected and removed. You see this jaw is now right on the table. It has come out of the patient's body and it is right on the table. It is resected along with the tumor. Now what? This is the portion again in another dimension. So now that the tumor is out, the teeth are gone. Now the patient cannot be left over that your tumor is gone, then you go and live with whatever deformity you have. It is impossible because the patient cannot chew, cannot eat, cannot speak. So we need to reconstruct, and this is what we do. We take the bone from the patient's leg. Usually leg has got two bones. One of the bones is not very significant or not very important for carrying your body weight or for function. So this part of the bone, which is called fibula in medical terminology, is taken from the patient's leg. But here the problem comes. You see this bone is a straight bone, unlike your lower jaw, which is a curved bone. So we need to cut this bone into that shape. And for this cutting into the shape is where our 3D printing comes into picture. You see here, this is what I'm specialized in. I'm doing the harvesting of the bone from the leg. And then once that is done, see, this is what the 3D printing model is. This is the patient's, this is not some lower jaw, somebody lower jaw, something. This is the patient's lower jaw, which has been printed using a CT scan images. So I'm sure from previous sessions, you would have seen how this 3D printing process is done, either whether additive or subtractive methods, whatever. But this is what we do is, actually here patient had a big tumor in this part of the jaw. So what was done is on the computer, we do virtual surgery where the patient's jaw, the tumor part is resected and removed on the computer before actually we do it on the patient. And this part of the bone which goes missing in on the computer on the patient CT scan, we will put a new bone mimicking the shape, exact shape of the patient's original jaw without tumor. That means we imagine how the tumor, if there was no tumor, how the patient's jaw would shape. In that way, we will put the bone structure there and then we will print it and we'll get a physical bone out. So this is the shape of the bone we want. So based on this shape of the bone, because this is the midline, see how much U-shaped bone we want. So based on that, then we take a plate, we will bend it on the table in the operatory theater. This is what I'm doing in the operatory theater. You see, this is a titanium plate. We are bending it in the shape of the bone we want. This is a 3D printed bone of the patient's lower jaw. And then once we get that shape on this titanium plate, which is called a bone plate, then we will see this is the leg bone which has been adapted, which has been cut into multiple pieces. You can see this cut portion cut into multiple pieces, and then it is fixed onto this pre-formed, pre-shaped lower jaw plate. And then we will fix this to the remaining part of the jaw, and then you see how beautifully this entire shape of the lower jaw is replicated. Here you see there is no lower jaw at all, and here the lower jaw has been put back. This lower jaw is nothing but the bone which is taken from the patient's leg. Sir, you are saying something.
So that leg bone you have taken into pieces, formed like curve, and on that you put this.
Yes, sir. Yes, sir. And for us to form that curve, we need a 3D printing model of the jaw. Otherwise, we will not be able to know how to curve the bone in that shape.
To bend the plate, you are using this 3D printed model. Then behind that, you put that pieces. So they will join later by a natural way. They will try to join.
Yes, sir. So once that is done, see, this is what it is. This is how the problem is defined. This is how we print. This is the tumor in the patient. We resect it. We reconstruct using a plate. So you can see here how the plate is bent. This is the part of the jaw which is replicated by using a normal mirror imaging procedure. That means, if, for example, if the tumor is on this side, we remove the tumor from that side and we mirror image this part of the normal bone onto this side to get the exact shape of the original bone. And then we use a plate to replicate, to create a template, and then this template plate will be used on the patient's leg and then that straight bone will be cut into the shape of this bone. See, this is what it is. And then once this is all 3D, and then we can put the teeth onto this bone by exactly getting the relationship in a correct way. I will show you in subsequent slides how this is also done. So this is what the
software used, sir? What is the software used for that?
So this software is called Mimics software, sir. Mimics.
Mimics you use. Okay.
Yes, sir. Mimics software. So this is what, and we have another software also, sir, which is given by Synthes. Synthes is a debut Synthes, Johnson and Johnson company. That one of these two softwares we use. Sir. So this, and you see once that is done, and then the bone is put, and then the teeth are also back into original position. See, this bone was pre-bent into the shape of the bone, 3D printed mandible or 3D printed lower jaw, and then we have put the teeth, and you see beautiful teeth. Entire thing is healed and completely normal. So this is the patient who came to us, and this is the patient after the surgery. If you see, you can't even make out that he has been operated and his lower jaw is completely removed. His entire face is just looking even better than what it was before the surgery. This projection is gone here, and then everything looks absolutely normal. And you see, this is the bone which has been bent, and this is the plate which have been used. And then he will get teeth in this place, and then he will have complete normal functioning and normal jaw movements. That is what this is possible only because there is 3D printing available. Imagine the days when there was no option of 3D printing. This treatment, this kind of reconstruction was just impossible. You can't even imagine. So this is where the role of 3D printing in medical and especially facial reconstruction comes into picture.
You have given life to that person, sir. You have given life. Big clap for you.
Thank you, sir. Thank you, sir. That is what is our job, sir. Thank you so much. So this is another patient. This is not a tumor. This is simple cosmetic problem. This is a young boy. He's just 26-year-old, unmarried, and you see his jaw is so oblique, so unnaturally placed because he has got some growth deformity. He had sustained some trauma during his growing ages. That means when he was 8 or 9-year-old, and because of that, his upper jaw did not grow only his lower jaw grew, and therefore he needs surgery where his upper jaw and lower jaw will be repositioned into new place. That is what is the thing. See how he is looking. The entire face is so awkward, and he faces so much of social stigma. He's so self-confidence is so low because of his facial appearance. He's a software engineer, but he feels so conscious to go to his office. So see, this is what we do. We have taken the CT scan again. We have put it on the computer. This is how his jaw is. Then we do surgery on the computer. We get the normal relationship of the upper and lower jaw. And then once that is done, we print a splint. This is a 3D printed splint, which will be used as a template on the operatory table so that we can position the jaws exactly the way we wanted in the computer on the real patient. That is what this 3D printing will help in doing cosmetic procedures. This is another thing. This is actually research which we did along with Shivram Krishna sir and his department on orbital reconstruction and on this is called orbit. That means orbit means your eyes. These are the orbits. This is nothing but eyes. Your eyes. You see, this is the nose and this is the upper jaw, and lower jaw is missing here. We didn't print that part. So here what happens is many times whenever a facial injury happens, your eye gets injured, and this eyeball which is sitting inside will get injured, and therefore what happens is this bone fractures and the eyeball position changes. So it is very important that we reconstruct this entire bone in a proper way. Otherwise, what will happen is, because you have two eyes, one eye will be in a abnormal position and one eye will be in normal position. When you look at a patient, the deformity will be striking. One eye will be looking in one direction and one eye will be looking straight. This is very, very common kind of trauma which happens. And what we do, we print the patient's facial skeleton. Here, what we do is this fractured bone is removed on the computer, and then we mirror image the normal bone onto this side, and then we print it. Once we print it, what we do is we take a titanium plate again. This is a titanium mesh, which will be bent in the shape of that bone exactly on the 3D reconstruct what we have made. And then this will be taken into the operatory table, and this mesh will be used to support. This is the eye of the patient. You see, this mesh will be placed below the eye globe so that the entire eye globe will get exactly the shape of the normal eyesight, normal sight. And this will support the globe of the patient. So globe means the eyeball. I mean to say eyeball of the patient. So this is how we reconstruct the entire orbit or entire eye so that the patient's eye will look normal. Patient's vision will be normal. So this is another patient where his entire half of the face is gone because of some tumor. And then this is again 3D reconstruction which we did. And then you see here, this is a even 3D printed eye. This is a 3D printed. He doesn't have eye. Completely eye is missing. So the eye can be completely. This is non-functional eye. It does. He will not be able to look with that eye. But cosmetic wise, he will look absolutely normal, as if nobody can even make out that he doesn't have an eye. So it looks exactly similar to that of the normal eye. So the eye, a lot of things. Organ printing is coming up nowadays. We are printing not just the metal plate or not just the acrylic bone, but we are almost reaching to a stage where we are able to print bone with bone-like material. That kind of revolution is happening in 3D printing. I will show you some videos and some slides on that also, so that you will be able to understand. So we can do metal printing using 3D facial scans. See, this patient has got missing bone in this area. So the entire bone is missing, and then we have to reconstruct this entire bone. So what we do, we have printed. This is a pre-surgical workup of this patient. So we have printed his entire jaw without this bone. This bone is missing, and there is a plate which was operated by somebody else before, and the patient has come to us with this condition. Now we have to generate a new bone in this, or we have to put new bone in this. What we do surgery, mock surgery on the 3D model first. That means we have removed the plate, we have cut this, and then we have understood exactly how much the deformity is. And then what we do, we create a device like this. This is a device which is called distractor device, and which will be put onto the patient's jaw like this. And then we will allow the bone to grow between these two segments by putting some bone morphogenic protein, that is called bone growth factors, so that slowly the bone will regenerate and new bone will form. This can happen when we have small defects, not like a big defect, then we have to take bone from the leg. But whenever there is a small defect, we can use this. But this is printed using 3D reconstruct. This is a custom made thing for the patient. For this particular patient, we printed it. So this is how we put the device in the patient's body, on the patient's jaw, and then this is how the patient's X-ray looks once the device is put. And then slowly over a period of time, the bone forms, and then this device will be removed and thrown out after 6 months. So this is how immediately after surgery it is looking. There is no bone here, but after a few months you remove the device. See, these are all holes which was carrying the device before, and you see here new bone has already formed. This bone was missing before. So new bone has formed. This is not the end of the story. What will happen? Now the patient has got bone, but he doesn't have teeth. So again, what we do, we will reprint this again with a 3D printing technology. And then what we'll do, we plan the dental implants. That is the implants which carry teeth, like according to his shape of his teeth. We put some screws there, we prepare, and then we put the screws on this new bone which is formed, and then we create completely new set of teeth. These are the implants which are sitting in his bone, and then he will get completely new set of teeth with which he will be able to chew, bite, and eat normally. So he is just young, a 16-year-old, but he lost all the teeth. So we have created the entire lower jaw because of this implants. This is again another tumor similarly. So huge tumor which is removed and then which is reconstructed. See, this is the 3D reconstruct. We cut it and then we use the plate to bend and then use it. See, this is a huge plate because it needs a huge support, and then we have reconstructed it. This is another advantage of 3D printing is where it becomes very easy for us to teach our undergraduates and our postgraduates, because you have this printed model. They will be able to understand the three-dimensionality of in a live individual or on a screen, which is a two-dimensional image. You cannot see the bone in all dimensions by rotating it in all planes. But if you have a 3D model in your hand, say you can see the inside part, the outside part, the upper part, the lower part, everything just by rotating merely in your hand. So students will be able to understand the concepts very, very easily. So we always, to all our postgraduates, we insist that they do all their surgical practice on these 3D models, so that they will be able to get the proper orientation, and they will be able to understand how the anatomy means the shape of the bones exactly are, and that will be useful in teaching purpose. 3D printing. Implant planning, as I told, implants are nothing but the dental implants, implants are something which are put into the bone, so that these are screws which are put into the bone, and then once they are put into the bone, then we will be able to put teeth onto that, so that they will behave like a fixed teeth. For some people who have lost the teeth because of various reasons, we put this. Now the challenge is that, see, once the teeth are gone, you don't know where to put these implants exactly, because the bone is so thin and it is three-dimensional. You don't want to put the implant too backwards or too forwards. You should know exactly where you have to put. For that purpose, we do this 3D printing, and then we do mock surgery. We will mark where you want to go your implants, where you want your implants to go exactly. We will mark it. These are dental implants which will be positioned, and then we will see whether the distance between each implant is same or not. Because in live patients, when we are doing the surgery, we'll not be able to see anything like this because everything will be covered with skin. So we can only see it on the 3D model. Once we know that, we will make a template out of it, and then once we come to the patient, we will fix it on fix the template onto the lower jaw. Then these holes will be there on the template, and then we know exactly where to drill and put the dental implant and dental screw, so that exactly what we have planned, how many implants we planned, how many teeth we planned, how many screws, and where we want our screws to come, exactly they will come there. If you see here, there is a yellow line here. This is a nerve which supplies your lower lip, which runs through the bone, it is present inside the bone. So if you don't have this 3D model before, by putting the screw inside the bone, there is a very high chance that you will injure this nerve. Once you injure the nerve, the patient will not have any sensation in the lower lip. That means if you eat, if you touch, you will not feel anything on this lip. That lip will become completely numb forever, for lifetime. And you see, the patient will get nice set of teeth, but they cannot feel anything on the lower lip. What is the use of getting that kind of dentition? So this 3D reconstructs or 3D models will help us to know where exactly the nerve is, so that we can plan how much length the screw should go inside. See, this length is longer because nerve will stop here. So we can plan longer screw here, but here we plan shorter screw because we don't want to injure this yellow structure, which is the nerve. Nerve means it is a small fiber which supplies the lip and connects you to the brain, so that you can, if you touch some ice here, you will feel cold. Why? Because of that nerve only. If that nerve is gone, even if you put your one hot pan also on the lip, you will not feel anything. So that is the problem with improper planning. And all these things are possible only because presence of this 3D printed models. Without 3D printed models, so this one, sir, this is a polymethyl acrylic, sir, PMMA.
Which technology used, sir, for making this? Which technology used?
In the sense, sir, additive technology, sir.
Which technology, like Polyjet or FDM? Which one is used?
Sir, this is FDM, sir. FDM.
FDM, okay.
Yes, sir. This is another thing where probably previously Reddy sir would have covered about, I don't know, I didn't attend the lecture, but he would have covered about knee replacement surgeries, total knee replacement, knee joint replacement surgeries and all, because he's an orthopedic surgeon. I thought probably, I presume that he would have spoken about those things to you. Now here, the point here is, see, if you see this one, this is a lower jaw, and lower jaw has got a joint here where you can open and close. That is where all the movement of your lower jaw happens. Like your knee joint, like your shoulder joint, this is also same. It's a joint, but a smaller size. Now, because of overuse, because of aging factor, because of the sometimes eating very hard kind of substances, your joint will start aching. It will start clicking sound, and it will start causing some degenerative changes. Means it will get damaged over a period of time, and because of that, now your mouth will become stiff and you will not be able to open the mouth because this joint becomes very painful. In these situations, what we do, we replace the joint with an artificial joint, like how knee replacements are done, how hip replacements are done, like that. This joint, which is called temporomandibular joint, is also replaced many times. And when we do this, for this also 3D printing is useful, because this is how we do. See, I'll show you this image. This is a 3D printed model where we have wax carving of this is the waxing of the artificial joint. We create an artificial joint like this, and then once artificial joint is created, we know exactly where to place this artificial joint, and then we print a titanium artificial joint. This is the artificial joint which is printed. So we go to the operation theater, we remove the infected or diseased joint, and we put a new joint which is completely functional. See, this is a ball-like thing. This is a socket where the joint moves and then helps the patient to open and close in a normal fashion, like any one of us are doing. So this is another kind of revolutionary thing which is happening in Western countries now. Almost 40 to 40% of the individuals have got knee replacement joints, and almost 5 to 10% of the people are going for the TM joint, temporomandibular joint replacement surgeries beyond the age of 65, 70, because the degenerative changes with age, which happens in the joint, arthritis, it is called. I'm sure all of you would have heard this word called arthritis. That means painful joint. So this is a very, very important. This is a 3D printed titanium joint, which is custom made for this patient based on his joint, because everyone's joint is slightly different in shape. We can't take one person's joint and replicate and try to put it into another patient because it doesn't suit them. So we need a customized joint for which 3D printing is very, very useful. This is how, see, this is a print, this is a stereolithographic model, and here you can see how the joint is prepared, and then this is the CT scan of the patient where the joint has been placed in the original position so that he can function normally. See, this is X-ray after the surgery, how the joint has taken its place. So this is for the upper jaw, again, the dental implants, how we reconstruct when upper jaw is gone, how these teeth are, these are the dental implants which are placed so that he will get the teeth back into his original position. And this now, another thing which is coming up is, you don't have to put the bone, but we are printing titanium mesh, and then 3D titanium in case of in place of bone, we are putting that. I'll show you a video, you'll understand. This is a 3D printed titanium in place of this bone, which is gone missing because of a tumor, which was done for a patient. See how this titanium mesh will go and sit. I'll just show you this video. Sir, can I share this video, sir? I'll just try to share the video. I hope it plays. Is it visible? Hope I am audible. Hope I am audible. So this is a titanium, 3D printed titanium, you can see. So same thing, this girl has got a big tumor on the lower jaw.
Sir, we are unable to see the video, sir. We are unable to see the videos.
Oh, okay. 1 minute, sir.
Please share out of the PPT, then you can.
Yeah, I'll do that. 1 minute.
Otherwise, you can do one thing, sir. You go to insert in PPT. Go to insert.
Sir, actually, it is inserted in the PPT, sir. I'll do one thing, sir. I will share it from my this one, my folder only directly. Video. 1 minute.
Then you have to come out of the PPT sharing.
Is it visible now, sir? No?
No, not visible, sir.
1 minute. Then I'll do that. I think I will have to close the PPT and then do that.
Yeah, you have to come back. PPT, you have to.
1 minute.
Sharing mode, you have to. You stop sharing, sir. PPT, then you can share the videos.
Actually, I'm not unable to see suddenly my screen.
Sir, one thing is, sir, you are unable to see. Yeah, that's why it's appearing blank for us also.
Now,
I think now we are able to see your PPT, sir.
I'll just share the stop sharing.
All right.
Now I'll share the video, sir.
Yeah, now you share the video.
Is it coming, sir, now?
No, you have to share the video, sir. You have to go to share again, select that files.
Oh.
Same thing you have done PPT. Now you put share and select that files. You have selected share, sir?
Yeah, I have selected the share, sir.
Now PPT is coming, sir. Now you select the PPT, sir. You select that. You select your videos.
Yeah, is this video coming, sir, now? No,
it's not still playing. It's your selection. You have selected this scene, but playing we are unable to see that. Sir, what you can do is, sir, you have You have put share mode now, sir.
Yes, I have put the share mode.
In share, you can select that video. Again, blank screen is there.
1 minute, sir. 1 minute. Now also blank screen, sir, again.
A blank screen, sir.
Sorry for this inconvenience.
No problem. Usually it happens.
Actually, like we are not very familiar with this technology things. So
yeah.
we have this confusion.
That's true, sir. You can
Actually,
just.
I'm not able to see my WebEx where it has gone. That's a problem.
Oh. You have come out of the share, sir. You are in the still share mode.
I'm in share mode only, sir. Actually.
Okay. Then after sharing, it will ask you to select the file, sir. That file you select. Now you are your file is visible, but video is not running. On your side, video is running, sir. Video is playing.
No. I have not played the video now. I'll try to play it now.
Now you play the video, sir.
Is it coming, sir? Coming, sir?
No, sir. Still your selection is there, but double click that one, sir. Sir, otherwise, one thing you can do, sir.
Sir.
Simply go to your PPT, sir. I'll tell you one simple thing.
I'll do that. 1 minute, sir. Can you see the PPT, sir, now?
No, sir. You have to come back. You have to stop sharing, sir. This one.
Oh. Actually, I'm unable to see.
Unable to see your screen, sir?
No, I'm unable to see my screen, sir. Actually, that is a problem.
Now your video is this folder. Now you play that one, sir. That video you play now. It is there. You open your PPT, sir. I'll tell you. You open
I've
your
opened the PPT. Yeah, opened, sir. Already opened.
Now we are unable to see the PPT. I think you have not put share mode, sir. That is the reason, I think.
I am unable to see where the share mode is, actually.
It is at the bottom, sir. At the bottom.
No, sir. Actually, I'm not able to see my screen only, sir. That is a problem.
So you close the entire thing, sir. You close this share mode. Anything screen.
I could have avoided that.
Now you came back. So now you go to PPT.
I'll open the PPT. 1 minute, sir.
Now you first go to share mode.
Yeah.
Share and select your PPT, sir.
Now PPT is visible, sir?
No, sir. Still it is not share, sir. You have to put share, sir. Select share.
That again.
Now it is shared. 1 minute. Now PPT is visible, sir. Sir, go to insert, sir. In top menu bar, you see
insert. Yes.
Click that.
Put the insert.
Then you get the right. You move right, sir. Video is there, sir. You are able to see right side video. Right.
Only video on my PC.
Video on my PC. File where it is located, sir.
Yeah.
Please select that one. Now you insert. You selected insert, sir.
It is inserting, sir.
Right now. Now you play, sir. Now your presentation mode. You go and press that one. Will run.
Yes.
Now it will run, sir.
Is it coming, sir?
It's coming, sir. Right,
okay. Thank you so much. Thank you. Audio is not there,
that's
sir.
The problem, sir, we are facing.
No problem. I'll explain. So this is again a young girl. I can see here. She has a huge tumor here on the lower jaw. Again, so this is a surgical procedure where this is a patient-specific 3D printed titanium. You can see this is a printed particularly for this patient. So this is a surgical video. You can see that her bone will be removed, lower jaw will be removed, and then we will be putting that printed. So this is the printed. This is the tumor portion of the patient. This is where the tumor was present. We printed it, and then we prepared a cutting guides, which will help us in cutting exactly the part of the bone which we have planned on the table. So this is the tumor part which is marked on the patient's face. This is the face of the patient, lower jaw of the patient. See, these are the cutting guides. So we are cutting through the patient's skin. So see, this is the lower jaw now, which is coming into picture. This is the tumor part. This is the tumor part. See, this is a swelling you can see here. This is the tumor. This is a normal bone. So we'll cut this tumor part and remove it. See, we are using this cutting guide, which is nothing but a 3D printed guides, which we are going to use now, so that we can cut exactly the place where we wanted to cut. We don't have to decide on the patient and during the surgery where to cut. We have already decided it on the computer, and then we have put it on the patient's jaw and then cutting through that. So we have no problem of planning, thinking on the table at the time of surgery. So the jaw is cut now. Don't worry about this bloody things and all. It's very normal in the surgical field. So you don't think that so much of blood and all, it's normal thing. See, his jaw is now cut. It is separated. It is removed. The entire, this is the tumor. The center part is the tumor. So removed along with the tumor. Now see, that is a 3D printed model of the same patient. And this is the 3D printed titanium, which we are going to put it in the place of the removed bone. We are just checking whether it is fitting properly or not. And then don't worry about this. This is just some bone growth material which we are going to put there so that it will help in bone formation. And these are the teeth which are going to come into that place. See, now this we are fixing this custom made 3D printed titanium plate, which will take the place of the bone. So we don't have to take bone from the leg at all. We can directly put this and then reconstruct the entire lower jaw.
That is made of titanium, sir?
Titanium, yes sir, yes sir. It is a biocompatible metal, sir. It will not cause any harmful reaction in the patient's body.
What is the technology used for producing that one, sir?
Sir, I'm not very sure, sir. Probably it is a sintering model, sir. I don't know. Laser sintering.
DMLS.
Yeah.
DMLS.
Those terminologies I'm not very familiar, because we send it to our those people. They will just do it and send it to us, sir. Those department people.
So we have that facility with us.
Yeah. You told us a few days back. I remember, sir. So this makes our job so easy. The entire teeth have come into place.
How much life of that implant, sir?
Sir, actually, it is supposed to stay lifelong, sir. But because it is a metal, it is known to get rejected after, say, 2 to 5 years. Means it will, some part of the metal will come out, will be visible and all. At that time, we will have to remove and again put a bone, sir, again in that place. But at least to some extent, it will help. At least for some time it will be there, sir. Actually, sir, this metal 3D reconstructs are still in the phase of research, sir. Still, a lot of studies are going on. We are also working on some patients. Some randomized control trials are going on, where they are trying to use various kinds of combinations of metals so that how they behave. But as of now, there is no long-term proven outcome with the metal. So always bone is best replaced by bone only. This is only an option where you cannot have a bone replacement, then you can use this titanium. but it is very expensive, sir. Very expensive.
What about hydroxyapatite, sir? Hydroxyapatite.
Sir, hydroxyapatite will not stay, sir. Hydroxyapatite will get rejected. It will, and also the strength is not enough, sir. Hydroxyapatite, metal strength will not be there for hydroxyapatite. It will break within few days. The moment patient tries to chew anything, it will break, sir, and it will not serve the purpose. That is a problem. Now my screen PowerPoint is not visible now, sir. I'll just share it. No, yet this is.
You go to sharing mode, sir.
Yes. Now is it visible, sir? PPT?
No, PPT is not visible now.
One. Now is it visible, sir?
Now visible, sir. Now it's visible. You can continue.
Right. Okay, right. That's our professor, actually, Dr. Girish Rao, who's narrating that entire surgical procedure in the video. So this is again a similar thing for the upper jaw. So many times, in cancer patients and all, they lose the part of upper jaw. This is the upper teeth. So that also can be reconstructed using a titanium. In upper jaw, the titanium will work very well. But the lower jaw is a very dynamic bone where you move. Upper jaw you cannot move in your face, but but the lower jaw moves whenever you talk, whenever you chew food. So it needs more strength, and then that's why titanium is not very suitable as of now for the lower jaw. But for upper jaw, this titanium will take a very good shape and very good place, and it can be used to reconstruct the entire upper jaw comfortably in the patient. So these are the various reconstructs which are used, which are prepared for upper jaw. You can see here upper jaw is missing, and then this is the titanium reconstruct which is prepared, and then which is put into the patient's missing upper jaw place, and then reconstructed, and then final outcome, you see his entire teeth also have come into place along with the titanium reconstruct. So coming to the advantages of this, obviously it reduces the human translational error, the 3D printing. It has become a major factor. Because of this, lot of minor human errors, major human errors are completely gone into vogue, and it has revolutionized, as I said before, the entire medical reconstructive procedures. So it becomes very easy to use, ease of use, as you saw in the previous video. The surgery time, which usually takes 8 hours for the leg bone to be transplanted, will take only 4 hours for this titanium printed one. And so the half of the time of the entire surgery is reduced. Half time reduced means patient's outcome is also so much better. Imagine 8-hour surgery to 4-hour surgery. It becomes very easy for surgeon, for the patient acceptability increases, and therefore, and if you are doing bone graft from leg, as I showed you in one of the first slides, then it becomes very easy for us to shape the bone accordingly, and so that we will be able to get exact shape of the facial bones, which are multidimensional. And it reduces trial and error while harvesting the bone. Harvesting means removing the bone from the leg. You don't have to try and cut and see how it is fitting and not, because you already have a model in front of you. You know exactly that shape you want to create. So it becomes very easy for us, the entire procedure. It improves patient acceptance because the surgical time is reduced in patient. It is easy for us to explain to the patient also. We have a 3D model of the patient's face in front of us. We can show the patient the model and show him where the tumor is and how this tumor is removed, how the bone is reconstructed. It is very easy for us to educate the patient regarding the treatment plan, regarding the outcome, how the things are done. So that's a major advantage of having a 3D model. As I told you, it reduces the operating time, and it also gets proper shape and dimensions to the face. Occlusion means that upper and lower teeth, the way they contact. So because of this, we'll know exactly how the upper and lower teeth can be brought into contact. Because if we don't have proper contact between your upper and lower teeth, how much ever you have good facial aesthetics, you can't chew your food properly. Just all of you sitting there, if you just do a small experiment where you can move your lower jaw slightly, but just 1 millimeter to right or left, and then try to bring your teeth together and see how difficult it is for you to bite your teeth, and imagine living like that forever throughout your life with slight 1 mm or not even 1 mm, 0.5 mm, slightly move to right or left your lower jaw and try to bite. Your teeth will never meet in a proper fashion, upper and lower teeth. And imagine like that, if you live forever and then you will not be able to eat also food properly. So this is where your 3D reconstructs come. You will know exactly where to put your teeth in relation to the opposite teeth. So it will help you in planning, so that the contact between the upper and lower teeth will be exactly as it was before the resection or before the surgery, so that patient will get good quality of life after the surgery. They will be able to chew, eat, and speak like any other individual. That is a big, see, living cancer free is not just important thing. Living cancer free, at the same time having good quality of life like any other individual, means as comfortably as any other person, as long as you are alive. That is more important. No point in being cancer free and being bedridden and being dependent on others. It doesn't serve any purpose. So the entire 3D technology will help us to move towards this good and great quality of life post treatment of these major diseases, the facial region. But yes, as I told you, it has got its own limitations also. Everything will come with pros and cons. If you see, major limitation is the cost factor. But as I told you, 10 years back, the cost compared to the present cost is significantly low. It has become much more affordable to many individuals. So it becomes easy for us to order for this 3D reconstructs now. Not only that, another major limitation is that nothing has so far come to near to the bone where it can be replaced with bone, like sir was saying hydroxyapatite. There are a lot of silicone material, there are a lot of metallic products which are in experimental phase where it can replace the bone completely, so that you don't have to take bone from any other parts of the body. But still, that stage is not yet come. Research is on. And myself, along with my department, we are also working on a injectable models where you don't have to even shape it in that form, but we have a injectable silica based material which contains certain products and bone production material. Because of confidentiality, I will not be able to name the products, but those can be injected into the site where the titanium reconstruct is printed and kept, so that it can regenerate the bone. So we are in the process of doing this study on a beagle dog animal study, and then we'll probably, if it works out, we will be able to bring it into the patient phase 4 trials, and then probably if it works out, we'll be able to bring it out into the market. But it is a long way to go still. We are in only very preliminary experimental stage, and it's an on paper concept so far. So this is the status of the entire 3D printing. So that's what I was saying. Organ printing, the many institutes, even including IIT Hyderabad, I'm sure many of you are aware of it, have gotten their own incubating center where they have got an organ printing facility where they have they are working on these kind of things. I know a few of my own colleagues who are pursuing PhD in that department there in these arenas. And then therefore, point here is the entire medical and surgical practice will undergo a paradigm shift with this 3D technology. And there are a lot of nanoparticles, as I'm sure you're all aware of, which are coming into practice now. Nanogels, they are called, as we are working on it now. These nanogels will make it, this 3D printing technology, even more user-friendly, even more patient-friendly, and easy to print and easy to use on the patient. And also, as I said, with increase in demand, the cost factor will come down even more. Previously, 50,000 worth mandibular model, now we can print it even just for 3,000 to 5,000 rupees. So that's a huge difference which has come from many years. And obviously, the technology of printing, the equipment which is available for printing, the time factor which is involved in printing has significantly come down from the previous. When 2008, I met Shivaram Krishna sir in mechanical engineering department and Venkatesh sir at that time. And then that is when I have actually been introduced to 3D technology. Until then, I have no idea, sir, believe me, that this kind of 3D printing exists. That is where, when I came along with Dr. Vivek Vardhan Reddy sir, my mentor, my teacher, my guru, to mechanical engineering department, and I met Venkatesh sir and Shivaram Krishna sir, and it's been a long time, now 12 years.
At that time, we arranged one week program.
Yes.
Venkatesh sir established news and CPTIP center, sir, SLS.
Yes, so I remember.
1 week, Vivek Vardhan Reddy sir was the chief guest for that one.
Yes, sir.
And then you came along.
That was the only unit at that time which had this facility in entire state of Andhra and Telangana, sir. I think there was nobody who has this facility.
Yeah. We have that SLS machine was there, sir.
Yes, huge one, sir. One entire room.
You remember one night you give.
Yeah.
Some eyeball note,
Yes,
and you
yes.
given that one. And Venkatesh sir, myself, and Chari was another student was there. We produced that within 1 to 2 days.
Yes,
it was
yes, sir.
helpful to in that office.
Yeah, yeah. Big machine, the entire room it was occupying. You have to put powder from one end and it will come out.
Yeah.
From,
Yeah.
so
Now
from
we have
there,
such type of big.
yes, sir. Now the
I think
technology
big
has
center.
come to. Yeah, now it's all tabletop printers have come now. So much of technology change now. So
Now we are
that's
having
what
big printers, tabletop also, sir. We have now
tabletop also.
SLM machine metal. We have SLS, and what is the
Okay.
old machine you have seen SLS? Then we have this Ultimaker FDM machine also, smaller one, and
Yes,
SLA
sir.
also, all the technologies.
Yes, sir.
Our Venkatesh sir will speak, sir. He's on the line. After you finish your lecture, we'll do it.
Sure, sure, sir.
Please.
I think,
Go
sir,
ahead.
actually, the Usmania University, your department is a pioneer in introducing this 3D technology in our state. Otherwise, we have been practicing from so many years. Vivek Vardhan Reddy, sir, my mentor, has been practicing so many years. But first time we got an opportunity to see this technology, and that is where when we adopted this technology, and then we have used, and we did many studies, as you mentioned, with your PG students and your students. We have conducted many studies.
Maybe yourself and myself, Venkatesh, we all published so many papers also.
Papers also. Yes, yes, sir. Exactly.
Recent
So
UGC
this-
project also was there, sir.
Yes, yes, sir. Correct, sir. So this is what the technology. It will be very handy to us as a surgeon because it will just make our job very easier. Though you people, as a technologist and engineers, work in the lab, but your contribution in the surgical department, in the operatory theater, is immense because of that a lot of background work which goes on in the lab, and because of that work you people are all able to do. It makes our job much easier, and indirectly many of you are contributing to the patient's safety and great results and great outcome what we are getting on the patients. Definitely 50% of the credit should go to you all, because without your back support in the lab, by making all these kind of gadgets, and with these technological advances, with these new inventions, with these pioneering ideas, nothing medical field cannot go that would not have come this far, and would not have been in a position where we can give this kind of best of the care to many of our patients. So I must thank all of these engineers, technologists, and the great people sitting and listening to this lecture. And it's an opportunity that we continue to work together for many, many years, and then bring great inventions, all with the one goal that our patients will have an ultimate outcome and ultimate result, and all of them will be happy at the end of the day, and disease-free at the end of the day. So this is my team which we work. Dr. Vivek Vardhan Reddy, as we were talking about, he's our mentor, our guru, and because of him, that we are all doing this kind of work. We are all trained under him. All the 7 names what you see under him, under his name, is what we are all trained by him only, and never a day goes without mentioning his name. He is Dr. Vivek Vardhan Reddy, sir, and then these are all our team members. Usually I involve in reconstruction part, so we are a reconstructive team, and this is a resection team who do the removal of the tumor part, and we team reconstructive team is one where we reconstruct. So that's why I am more involved into 3D technology, because I am the one who is more involved into reconstruction. Whereas resection people, what is their job? They just remove the tumor and throw it in the dustbin. But our job is to reconstruct the entire thing. So that is where the 3D technology comes into picture. So my acknowledgements to my all gurus, Dr. Subramaniam Iyer from Amrita Institute of Medical Sciences, where I did my fellowship. He's one of the greatest surgeons India has ever produced. He's one of the first surgeon in the country, in the Asia, in fact, who has done the hand transplant for a Afghan soldier who lost both his hands, and then cadaver hand transplant. It has come in all the news, including prime news channels, almost 5-6 years back. So privileged to be trained under him long back. It was 2011 I was with him, and now we moved on. And thanks to Dr. Shivram Krishna sir, Dr. Venkatesh sir, and for giving this opportunity, and Dr. Aditya Mohan, who is also a maxillofacial surgeon. I'm sure sir knows him. Venkatesh sir also knows him, who works with us in this 3D technology. He has got his 3D lab. So, and some of these slides are shared by him, and some of the slides are of our own patients. We work for some cases together with Dr. Aditya Mohan. And these are all other team members and our postgraduates who work day and night in the operatory without any rest, without food, 8-hour, 10-hour, 12-hour surgeries at a stretch. So without their contribution also, this surgeries and these kind of procedures would not have been possible. So thanks to all of them, and all our residents and our postgraduates. Thank you, sir. Thank you so much for your time. Venkatesh sir, thank you again, once again, for giving me this opportunity and for being associated with us for many, many years, sir. Thank you so much. Any
Sir, I would
questions?
like to
Most
say
welcome,
your
sir.
college, SVS Dental College, very proactive, sir, in this research work, and especially your team led by Vivekaradan Reddy, sir, yourself. You are
Thank you,
always,
sir.
whenever we ask, sir, how to do it, you're ready to help. And I think you said we all feel that the doctor is a god, sir, on earth, but in the god, we are like a weapon to kill the demon, right? Engineer will become a weapon. So we kill the
True,
disease.
true, sir. Very true. Very nicely said, sir.
Only
Yes.
weapon will not function. Only doctor should be there, and doctor will be using us as an instrument to kill that disease. So we are proud of you that
Yeah.
we both
We
join
are
hands.
Yes, we are nothing without those weapons, sir. So that is all the weapons are actually, including from a small blade which we use in the operatory, is manufactured and designed by the engineers. So without
Yeah.
that, we cannot do anything. So it's all mutual, sir. Thank you so much.
Sir, now we'll go to question answer. Sir, a lot of questions are coming up, and
Yeah,
some
please.
people want to directly speak also. First, I'll put one question, sir.
Yeah.
So we'll go ahead with the question answer session. Then I'll ask Professor Sri Venkatesh to say his few words. Now,
Yes, sir.
first question is from Rupa Tulasi, sir. Hello,
Yes, sir.
doctor. How can we optimize the cost of the whole procedure compared with 3D printing and traditional method? I mean, in the patient point of view, which procedure can be affordable by most of the people?
Yeah, very good question actually. See, in olden days, before this 3D technology was used, we have to do any of these procedures. What happens is we have to the surgical time usually will go on for say 10 hours, 12 hours. Whenever the surgical time is so long, patient's ICU means intensive care unit stay will prolong. Patient's total hospital stay will prolong. So because of this, the patient cost factor and the patient's morbidity, that means the ability to come out of the surgery becomes more and more and more and more difficult. So previously, these surgeries were considered to be extremely complex, extremely dreadful, highly risky surgeries. But now, because of the availability of this 3D technology, most of the surgeries are planned on the table in the laboratory before actually going into the operatory theater. So because of that, what happens is we don't take any shocks or any surprises when we are on the table with the patient. Because of this, our entire surgical time from say 10 to 12 hours, it would come down to 5 to 6 hours. That means the entire cost of the patient, because the cost on the patient, the cost burden on the patient depends upon how many hours patient has been operated, how many days the patient was in ICU, how many total number of days patient stayed in the hospital, how much of medication patient has been given. All these factors are interlinked, and they all will come down because of presence of one 3D model in our hands. Because we have the 3D model, we have all done the plan. We have to just go and execute it, and we have to do step 1, 2, 3, 4, 5, 6 as we have planned in the lab. 1, 2, 3, 4, 5, 6. Same pattern follows, and there will be no surprises. So the entire surgery will come down to 5 hours, and then patient ICU stay will come down to just 1 day, and patient will be able to walk home within 3 to 4 days. So the cost of the surgery, say 8 lakhs, would have come down to 4 to 3 lakhs, and then another rapid prototype model, which would have cost probably 40-50,000. So that is how the significantly 50% of the cost reduction can happen because of the technology advances in rapid prototyping or in 3D printing. I hope I
Apart
answered
from
this.
that, I feel, sir, you have the answer. Apart from that, I feel that the trauma that goes with 3D
Yes.
printing is very heavy when compared to the price.
Yes, yes.
That you are able to reduce the operation time, everything.
Yes, sir.
So in fact, we have done with Sunshine one operation, facial asymmetry, with Suresh Kumar.
Yes,
He's also
Suresh.
my
Yes,
facial
yes.
doctor. You heard about him.
Yeah, of course.
So
I know
he is.
it.
We made him reduce the operation from 6 hours to 3.5 hours.
Yes.
50% time it was, and more accurate hours.
Yes.
So another question, sir. Chidambaram is asking, thank you for including us as a 50% in contributing the patient life. He's happy that your is also consideration. So Chidambaram, it's the order of the day. Both of us should join hands, and then only we can work.
Absolutely.
That's what we require. Because SAR became allowed, the BPC became a doctor. I like the MPC, I became engineer, but now we have to both join, become M by PC. No, it's right.
Yes, sir. Yes.
So his first question is, sir, can you explain technically why titanium is somewhat not okay for lower jaw? Right.
Yeah. Again, good question. The titanium, the problem with the lower jaw, actually the problem is not with the titanium. The problem is with the lower jaw. What happens with the lower jaw is it is a very dynamic bone. That means what happens, whenever you even swallow, you speak, you make any movements, it moves. And what because of that, no, the bone along with the titanium keeps moving, and because of that, there is a constant friction between the bone and the titanium. They both rub against each other. Even though we fix it with screws and whatever armamentarium available, that micro friction which keeps happening between these two will cause erosion of the titanium or erosion of the bone, because the titanium is very strong metal. And because of that, the slowly gap develops between, over a period of few years, the gap develops between the bone and the titanium, and there is a dead space, empty space between these two because of the erosion of the metal or erosion of the bone. And because of that, no contact between the bone and the titanium over a period of time, the titanium tends to get rejected by the body because of the body reaction, because of the no contact. And the titanium, the skin present over the titanium becomes very thin, again because of the friction between the skin and the titanium. And then the titanium starts getting exposed either outside the mouth or inside the mouth, and then it will become visible. Once it becomes visible, it becomes very unsightly, and then once it becomes visible, there is a high chance of getting infections. And because of that, the titanium is not so far very successful in replacing the bone, which is a dynamic. Whereas upper jaw, it is very comfortable because it doesn't move at all. So there is no friction or micro friction between the skin and the titanium or the bone and the titanium. So it remains stable there. That is the main difference. The problem is with the jaw, not with the titanium.
Sir, you can visible more and stop.
Yes. Sure, sir.
So, next question, second question is, sir, same person. He asked you, will you wait all the blood to drain during surgery?
Sorry, sir, I didn't get it. Please, once again.
All the blood to drain during surgery?
No. If all blood goes...
it drains out, then he will drain.
No, sir, no. What happens is, see, whenever we do surgery, some blood loss is imminent. Blood loss will happen, but we will be controlling as much as possible so that patient will not lose all the blood. If patient lose all the blood, patient will die on the table. So the human body has got 5 liters of blood, and losing up to 1 liter of blood is not harmful at all. It can be always replaced, and it can be replenished. Within few days, again, that blood will come back. So, and usually major surgeries also, usually not more than 1 liter of blood is lost. We will be in a very controlled environment. We know how to control that bleeding, but it will not be completely bloodless. Even if you get your finger cut, some blood will be lost. Similarly, there also blood loss will be there, but for you, it will look with lot of blood is being lost. But what we see is as very, very less blood loss. That is not a significant amount of blood loss. So we don't make all the blood to lose. That doesn't happen.
Okay. So next, same person, can you tell average cost of doing knee joint replacement, also other surgeries?
Knee joint replacement is an orthopedic procedure, not a maxillofacial procedure. But as far as I have knowledge, it usually costs around 3 to 5 lakhs, depending on the unit and depending upon the kind of titanium grade they are using. Usually, it lasts between the two things. 3 to 5 lakhs usually.
Sir, across the country, nice presentation. As we are using 3D printed guides for operating. Sir, are you there, sir?
Hello? Yeah, I'm here, sir. I'm here. Am I audible, sir? Sir, yeah. Okay. Yes. Yeah, actually, your voice is breaking slightly. Yeah, please, sir. Yeah, voice breaking to me actually. I don't know about others. Slightly. It's okay, sir. You can continue.
Sir, now? Yeah, you are visible, sir. No, you are visible.
Okay.
You are able to hear me, sir?
Continue, sir.
Yeah. So as we are using 3D printed guides for operating instead of trial and error conventional method, which reduces lots of effort and time, whether it reduces the medical cost or increased it, sir?
Reduces the medical cost. Definitely reduces the medical cost. That is a major advantage. It reduces the medical cost. Overall medical cost also it reduces. As I told you, sir, previously 10 years back, the 3D printing itself was very expensive. So in those days, it was very difficult. But now the 3D printing, entire skull is printed with very, very minimal cost. it becomes very easy.
Yes.
It doesn't add much to the cost, and because surgical time is coming down, patient cost also comes down for the patient.
So there is a computer saying, sir, as per Moore's law, for every 1 year, the computer speed doubles, cost becomes half. That's the same way here
Yes.
also.
True, sir.
Technology
Correct.
increases, it comes down.
Yes. Yes.
So, sir, one panelist, Mr. Chalapati, wants to speak, sir. One participant wants to speak. I'll
Yes,
make him
please.
as a panelist so that he can speak, sir. And,
Sure, sir. Sure.
Chalapati, what is your number, ID number, Chalapati? I think, 1 minute, please.
Yeah, so no problem, sir.
ADP 128.
Sir, good afternoon, sir.
Please switch
Yeah,
on
good
your video, Chalapati garu. Please switch on your videos.
Yes, sir. Yes, sir.
Professor Venkatesh, you can also switch on your video, Venkatesh. Is it possible for
Sir,
you?
good evening, sir.
Please
Hello, sir.
introduce
Good evening. Good
yourself, sir. Introduce yourself, sir, from where you are speaking.
Sir, am I audible and visible?
You are audible and visible, sir. Please
Yeah,
go ahead, sir.
Thank you, sir. Thank you, Dr. Abhinand, for giving
Thank
an
you.
excellent presentation on this.
Thank
Actually,
Can you introduce
this
yourself, sir?
presentation has,
Sir,
yeah, I am Chalapati, sir. I am Chalapati, Associate Professor, Anurag University, Mechanical Engineering,
Okay,
situated in Hyderabad only, in Gatke, sir.
Okay, sir.
Sir, in this, actually, your presentation has opened a new era. Maybe there must be a new crash course or in multidisciplinary or interdisciplinary course, or maybe a complete program. Maybe we can call it as, instead of like a biomedical engineering, it could be a medical engineering, or maybe a mechanical medical technology, something which enable the mechanical engineers to design and produce the technologies or the instruments that you require in the medical
Yes.
field.
Yes, sir. Very true.
Especially, of course, as you said, sir, if you don't come across about the 3D printing technology through some person, it is very fortunate for you and even for all your patients and all of us, because you came across to Dr. Shivram Krishna sir and the OU. So because of that, you learned the 3D printing technology, and you are utilizing that in the application part,
Yes,
isn't
sir.
it, sir? So,
Yes, it's
the
true.
wide publicity, or maybe in kind of a new course or new program, that could be better, sir. So, in the policymakers or Sivaram Krishna sir, in the BOSS, I think we need to discuss about these kind of things also, sir, so that
Yes, sir.
there will be a lot of beneficiaries for this, sir. And of course, I actually couldn't realize that, or assume that the 3D printing can also be used in the dental, sir.
Okay.
But of course, I know that 3D printing is used in the ortho, because I heard some of the lectures even by Guru Reddy sir and others.
Okay.
But the dental, I didn't expect, because it is very small, and that is the usual practice every time that is goes on. Thank you, sir. Thank you.
Thank you, sir. Thank you so much.
Thank you, sir.
Sir, good evening, sir. Hello, sir. Venkatesh, sir.
Hello?
Hello, sir. Good evening, sir. Venkatesh, sir.
Hello?
Yes, sir. We can hear you, sir.
Yeah. Dr. Shivram Krishna. So actually, almost 50% I could witness the lecture.
Okay, sir.
Same as that of the Dr. M.V. Reddy, and a lot of inside details about the medical surgical procedures using 3D printing. And I think we have caught the very good people actually we need such people to have collaboration with our center, and I request Abhinand Paturi doctor to come to our lab and see our facilities, and we have a
Sure, sir.
we
Thank
are
you, sir.
actually working with this hospital since 2009, sir, actually.
Yes,
And
sir.
we have provided the skull and knee joint to some of the Parani hospitals and care hospitals. And we are not into the business like commercial, but we will provide you services on, like some patients not able to pay the amount.
Yes, sir.
So
Yes,
such
sir. Thank you.
we will help them, and at the same time our center of what you call get name in providing the social services.
Thank you,
Okay.
sir. Thank you. Thank you. Sure, sir. Sure. Thank you so much.
Dr. Shivaram Krishna, and we should have a cluster of people, medical, engineering, industry, R&D, and faculty. So
Shivram, sir, you are muted actually. We can't hear you. That's why.
no, Dr. Shivaram Krishna muted.
Muted. That's why.
Venkatesh,
Yeah.
actually, I want to tell you, sir, when we established our center in 2009, we conducted one FDP program 1 week. Remember that? For that, Vivek Vardhan Reddy sir came as chief guest. Along with him, Dr. Abhinandan also was there at the time.
Right.
So, in fact, he's associating with our center for the past 8 years.
Yes.
And we both have worked, yourself, myself, we all together worked and done lot of, we have done publications, combined publication. We have done, I hope, remember Chari, and we have produced one big skull eye coming out, all that works we have done with sir only. So Abhinandan sir is with our associate with us, and we will definitely take Abhinandan sir as one of our other advisors from medical field, along with orthopedic MV Reddy sir. We'll also take include in our team.
And
Sure, sir. Thank you.
Hobbies, immediately we plan for 2 days on only biomedical applications.
Yeah.
Okay.
Yeah, definitely.
Okay. So thank you, Dr. Abhinandan sir.
Thank you, sir. My pleasure, sir. Thank you.
Okay.
So, thank you, Venkatesh. In spite of your busy schedule of control of examination, he's conducting so many exams in Usman University. Sir, he's so busy. He's also
still need time to come. Yes, sir.
He's also coordinator of the program, and he's the man behind establishing the entire facility in metal everywhere, sir.
Yes, sir. I know.
He's a very senior person. So,
yes,
thank you, Venkatesh. Thank you for joining online. So,
thank you, sir.
Any more questions from audience? Otherwise, we'll wind up the sessions. So, on behalf of the organizing committee, I would like to thank Professor Abhinandan Paturi, a very young doctor, but very highly proficient in this 3D print technology application, in especially the dental and maxillofacial surgeries. We see few doctors with academic research interest. I am not most of, but young doctors also, it's very important because research should continue and the new technology should be embraced. And I think sir has been a lot of inputs to us. I think the challenge of not making to sleep is done because the interaction you see, so many people are still putting questions in the chat box, sir. And I think this is what we require at the end of any session because the interaction from the audience involvement is very important. This Atal AACT program sponsored by AACT, they are given free registration to all the participants. Now our program is attended by 200 people across the country, sir. So they are given free of cost by Atal. Otherwise, in other aspects, for this type of sessions, it's not that easy to join. But we have to thank AACT Atal also for providing that opportunity to us. And I think I thank you, sir, for coming and spending your valuable time. I know for a doctor, 2 hours, 3 hours time is so crucial. You are having so many patients waiting for you. Definitely, we thank you, sir. And as our director said that in future we are going to have so many academic activities apart from our center. We do live case studies. So we will associate with you, sir, and we will call you and Vivek Vardhan Reddy sir also for our center. And we'll have few more FDP programs and everything. That is academic way, but we'll also do your requirement to the patients. Everything we'll do it. We'll have a joint publication, patents, everything you can do it. Thank you very much, sir.
Thank you, sir. Thank you.
Short notice accepting our invitation, joining and spending your
My pleasure. My pleasure, sir. Thank you so much. Thank you. Thank you, sir.
Thanks. So audience, I hope today you had a very nice session from morning onwards. So today you had two biomedical sessions, and first one is design for manufacturing from eminent IIT Professor Kumar sir. Now I'll be posting this session feedback link to you. So please post your attendance come feedback link. I am now posting in this box, in the chat box. It's posted. Please answer. Please submit your feedback here. Tomorrow again we'll join at 9:50 as usual. It is in the chat box. I'll again post in our WhatsApp group also. I'll post. In the WhatsApp group also I posted. I request tomorrow all of you join by 9:50. We are going to have 3 sessions. First session is taken by topology optimization by Mr. Balaji from I4 Study. The second session by you, Chandrasekhar sir. He will be speaking on the quality aspects of metal 3D printing, and he is from Wipro 3D, director from Wipro 3D. Then the last session will be hands-on experience on using Cura and the 3D slicer software. Already I posted how to download the Cura and 3D slicer software. So last session, all of you should have a laptop with you, and I given you procedure how to download the software. We'll be sending today by mail the DICOM file to all of you. Please check your by evening. I'll be sending the DICOM file to all your mail IDs, and also we'll be providing you the handouts how to do. Apart from Chari is explaining you, parallelly you can open your handout and see how you can do it. Stepwise procedure explain how to do that biomedical modeling. So we are going to show all the things to you. Today I'll be sending the file of DICOM file, and also I'll be sending you the step-by-step procedure how to use Cura software and the slicer software. So tomorrow it is going to be more exciting. You are going to have a very interesting session on topology optimization because it's part of design. Then we are going to have a quality of metal 3D printing by U. Chandrasekhar, a very senior person in industrial application, especially is the GTRA chairperson for a few years. And then you are going to have a hands-on practice on using Cura and 3D slicer software. Please, I hope everyone will join. And I am going to stop this session now. And today's session is over. Thank you very much for all of you to joining this session and making it a wonderful